Morning. Next slide, please. I'm here to give a brief sponsor perspective from NIH. NIH is the largest public funder of biomedical research in the world. The mission of NIH is to enhance health, lengthen life, reduce illness and disability. Chronic medical conditions, including cardiovascular disease, cancer, and diabetes, cause more than half of the deaths worldwide. These long-term diseases affect people of all ages, rich and poor, and every ethnic group. Lifestyle choices, including diet, physical activity, and whether or not you smoke, contribute to this risk. So NIH's long-term goal is to understand, treat, and prevent chronic diseases and help people reduce and help the world reduce global burden of these conditions. So NIH does research across the lifespan. We want to address the health and well-being of children throughout their lives. And on the other end of the life stage, we are facing a dramatic change across the nation. Americans are not only living longer, but they're achieving higher levels of education, living in poverty less often, and experiencing lower rates of disability. So NIH research is exploring new approaches to help make these later lives as healthy and productive as possible, including nutrition intake. So this DRI update will utilize research from NIH and other important sources to provide critical information on sodium and potassium intake and health outcomes, and to help improve the lives of Americans and Canadians in the world. Okay, so next slide. So we're really excited about the strength of the process of the DRIs. It is informed by a rigorous evidence review, one of them being the ARC report that was just published. And it is the final report, so no more comments, no more public comments, just to clarify that. So we've had a lot of commenting, but we're finished. So strong scientific basis. The DRI update is needed given new evidence. So in addition to all the wonderful research that is being conducted by our extramural researchers over the past 5 years or more, collaboration by NIH federal agencies, including NIH, CDC, USDA, has greatly strengthened the science base for sodium reduction, including joint funding for 24-hour urine collection and NHANES, which you'll hear more about today, sentinel food surveillance and monitoring. And additionally, there have been updates, as you've heard, from the public for this update. Next slide, please. Okay, so how we use it, nutrition research greatly depends on the DRIs. It provides a frame of reference for study diets and nutrition intake and health effects that we're studying. It helps us look at the relationship between diet and health and the association with specific diseases. It helps us interpret research findings with nutrition, ongoing nutrition monitoring, and additionally, it helps with the gaps of the evidence and future research needs. Next slide. So the DRIs greatly inform the dietary guidelines for Americans. So there will be a new process that's already starting. So the dietary guidelines guide NIH in all federal nutrition education activities. It helps local, state, and national health promotion in efforts for disease prevention initiatives. It informs USDA and HHS children and adult feeding programs. And finally, the dietary guidelines are a tool for health professionals to advise consumers. Next, please. So NIH is currently conducting a strategic plan for nutrition research for the next 10 years. So this is the first ever NIH strategic plan for research. So the plan will emphasize cross-cutting, innovative opportunities to advance research over the next 10 years on a wide range of topics, from basic science to population research. Programs like this DRI update, we will see the research gaps, and that will feed into the strategic plan, which will be updated on a regular basis. Next slide. Public health outreach. I cannot underscore all the public outreach that NIH does. We're known for research, but we also have communication, education programs at all of our institutes and centers in regards to diabetes, heart disease. Another example is supplement fact sheets, which will be greatly informed by the DRIs. The DRIs will also be used for diet planning for hospitals, long-term care, nutrition counseling, etc. Next slide. And I want to thank you, and we look forward to the report, and I really appreciate the work that will be done by the Academy and this committee.